what a delight and an honor for us to have Dr. Susan Spear with us. She's the Senior Vice President of Medical Affairs for EHE International, Chairperson of the EHE Medical Advisory Board, and Assistant Clinical Professor at Columbia University. And Dr. Spear, I understand that EHE stands for Executive Health Exams. Is that correct?
Well, that's what it stood for historically. Today, it just stands for itself and our commitment to provide this preventive health program to all individuals, not just to the executives of the company.
All right. Hey, nice to have you with us today. And this is National Men's Health Week, appropriately so. How would you rate men's health in America? I
think men have a lot of potential to improve their health in America.
Okay, now let me ask you this. The research shows that men still don't live as long as women. Is that a health issue?
I think that's probably related to a lot of things, but the important aspect of it in terms of their health is there are many things that men can do to improve both the chances of living longer and the quality of their health during the time that they are alive.
All right, so let's take a look at this. Where do they start? What should they do to take a look and see if they're healthy and if they're going to live long?
Well, I think it's always helpful to assess where we start out, and assuming that we're just going to call this a fresh start for a given man, and he needs to gather a lot of data on what his current health status is, and then plan the various strategies for improving it based on what the key issues are today that make him at health risk. And in my view, the best person to help in that process would be a physician, somebody who he presumably has known for a while, and if not, someone who he's going to get to know through this process. So in a dialogue, in a discussion, in a very interactive process, the two of them can assess his health today and plan a program to improve the factors that put him at risk for health problems down the road.
All right, let's take a look at a couple of the ones that directly affect men. In fact, we had a report on our news here a couple of weeks ago, Dr. Spear, that there was consideration, I don't know if it's happening or will happen, but there was consideration that the PSA test perhaps would not be needed. How would you respond to that?
Well, there have been some recent revisions to various recommendations by the groups that look at these things, and the value of a annual PSA for every single man starting at a given age is certainly been questioned. But I don't really view that as any different than most recommendations. There are always pros and cons to any test, and I guess to anything we do in life. But in terms of the PSA, it's still, in my opinion, a helpful screening for prostate cancer in most men some of the time. So as opposed to having a rule that all men get X every Y interval, this is really a very important part of the dialogue with the physician. And there are pros and cons to doing a PSA, and the physician usually is the one with more knowledge, and it's certainly up to him or her to share that knowledge with the patient, in this case the man, but then to reach a joint decision based on the pros and cons for that man.
What about a colonoscopy?
A colonoscopy is not terribly different in terms of basic approach. The evidence in favor of periodic colonoscopies is pretty strong, but like everything else we do, there are downsides to it. Colonoscopy is somewhat unique in that through colonoscopy, you can detect lesions called adenomas before they become cancer. If left alone, they will go on to become cancer, and remove them. So it's one of the few screening tests that actually prevents, not even cures cancer, but literally prevents it before it has a chance to start. So I think it's something that every man should consider very carefully in terms of the benefits.
Annually, after the age of 40 or 45?
No, No, never annually, and there's a good reason for that. National guidelines recommend beginning at age 50. Here at EHE, we've done some studies to show that the lesions that I was explaining that are removed and prevent cancer can begin certainly in the 40s. So we would recommend beginning at age 40. At whatever age you begin, the frequency that you repeat it depends on what was found at the time of the initial exam. So if there are absolutely no polyps or other suspicious lesions found, then it certainly doesn't need to be repeated for something between 5 and 10 years.
Okay. Let's take a look at the average man today is working long hours, probably eating poorly, might not even be eating breakfast, and if they do, it's on the run. I would assume that that's probably the first area of correction.
That assumption is correct. The things that we need to do to improve our health are nothing extraordinary, nothing that you couldn't easily think of, and they usually have to do with nutrition and physical activity at the top of the list. And knowing what to do is not the hard part.
Yeah, it's doing it.
Absolutely. And you know, you mentioned a busy, stressful life, and adding something more in terms of physical activity is certainly and could be construed as just another stress. Eating well probably takes longer than eating poorly. So, you know, it's all a question of priorities and time management.
What kind of value do you put on water?
Staying well hydrated is very important to good health, and water is probably the best hydrator there is, because there really aren't any downsides to it. So I think drinking plenty of water is certainly a good thing.
All right, one of the big controversies is, well, in fact, whether or not an aspirin, whether it's a whole aspirin or a baby aspirin, which I think is what, like 81 milligrams or something like that, a day is a good thing. What do you think?
You know, I'm going to sound like all I do is repeat myself, but it depends on the individual. There are pros and cons, and for anyone at particularly increased risk for cardiovascular disease, it's a good idea. But the major issue on the downside has to do with this increased susceptibility to bleeding. So any condition that would make somebody more likely to bleed easily or suffer particularly adverse outcomes from that has to weigh the pros and the cons. So it is, again, a decision that's got to be made patient by patient, and sometimes changes over time.
It seems, Dr. Spear, that, again, the silent killer is heart disease, and most men just kind of, it happens, and they, you know, what do you suggest that we do to get checked out as to whether or not we're susceptible to that?
Yeah, it really doesn't have to be silent, because the warning signs are all there, and what you have to do is pretty straightforward. You need to know your blood pressure, and you need to know your height and weight, and what that means in terms of your BMI, which measures whether you're the best weight for your height, or whether you weigh too much or too little. So those are two numbers that are very easy to come by, blood pressure and BMI. And then there are a few simple blood tests that are going to give another important set of clues that mostly have to do with your blood lipids, basically the various kinds of fat in your blood, from cholesterol to triglycerides to things called HDL and LDL that most people have probably heard of. So, you know, I think if you have those variables assessed, in addition to a good knowledge of your family history, you're well on your way to knowing exactly how high your individual risk is of heart disease.
How important is exercise?
I would say exercise is extremely important to many, many aspects of physical well-being and good health.
All right, so this is the week. What do you want men to come away with this week as we go into this Men's Health Awareness Week?
Take a breather, take a look at yourself, do it with the help of a professional. And in this case, I would recommend a physician, and see where you are at a starting point and see what relatively simple things you can do to alter your own health outcomes. You really don't need machines or equipment or gyms or pills or fancy tests. You just need a little information and some determination.
If the men are watching now could walk away with 3 simple recommendations for change, what would they be?
Based not knowing where they sit today, but probably eat a little better, exercise a little bit more, and make sure your life is as balanced as it can be in terms of the things that cause stress and the things that cause relaxation and happiness.
Okay. That was my other question too. How important it is in men's health for them to just turn off and relax?
I think it's one of the critically important factors.
How about sleep? Where do you put sleep on the equation?
I'd put that high up there too. And I think you're also mentioning the things that are the most challenging because of the external stresses in all of our lives, and certainly all men's lives.
Is there some resources, Dr. Spear, that men can check out this week? Websites or things like that?
Absolutely. There's a bunch of good information put out by the government agencies that look at this. The NIH is one of them. The CDC is another one, and then any of the organizations that focus on a particular area of health. The American Heart Association, the American Diabetes Association, the American Cancer Society. There's lots of good information available online, and that's certainly something worth doing. It's sometimes a little bit hard to sort out the good from the not so good. So I still think nothing replaces as a starting point a conversation with a health professional who's spent a lot of years learning much more than any of us as individuals know about ways to achieve good health.
All right, my last question is, men take a look at this week and take serious consideration about their health. If they were to go in, what tests should they ask for?
They shouldn't go in asking for tests. They should go in and ask the doctor to explain to them, based on this individual's health history and health status, what tests the doctor thinks the patient would get the most value out of and why. There's just no cookbook. That's really what I'm trying to say.
Oh, okay. Hey, thank you so much, and thank you for your commitment for men's health. This is Men's Health Week. It's actually started yesterday, and we'll go right up through this coming weekend, which is Father's Day. Men, let me encourage you to get checked out. Just go to your doctor, get a little checkup and see how things are doing. Take a look at your eating, take a look at your exercise, take a look at your water intake, take a look at your pressure life. I shouldn't say all this, Dr. Spear, because I'm guilty of all of it.
Well, it's, the first thing is recognizing it.
Yeah. Hey, thanks so much for being with us. Have a great day.
You too. Thanks a lot.